This is the video on the parasympathetic nervous system. The parasympathetic nervous system's main purpose is for rest and digest, or rest and restore. It digests the food and allows the body to slow down, repair, and restore itself. It is the part of the nervous system that goes, ah, as you walk into your home after a long day. The parasympathetic nervous system originates in two locations, the brain and the sacral spinal cord. The intervening area belongs to the sympathetic nervous system. The cranial nerves involved with the PSNS are 3, 7, 9, and 10. The oculomotor nerve from the Edinger-Westphal nucleus heads out to the ciliary ganglion to close down the pupil. When you want to rest with your eyes closed, you do not need the pupil enlarged. Cranial nerve 7 from the superior salivatory nucleus heads off to synapse on the pterygopalatine and submandibular ganglia in the face. These ganglia send axons out to the lacrimal gland, mucous membranes of the nose, palate, the submaxillary gland, and the sublingual gland. This will make the mouth and throat moist and ready for food intake. Cranial nerve 9 heads out from the inferior salivatory nucleus to synapse on the otic ganglia. Axons from the ganglia head to the mucous membranes of the mouth and the parotid gland, again moistening the mouth for food intake. The vagus nerve originates in the dorsal nucleus of the vagus and the nucleus ambiguus in the medulla. It is the major player in the parasympathetic system. It heads out to the heart to slow down the heart rate and to the trachea and bronchi to constrict the bronchi leading to the lungs. When you rest, your breathing slows and your heart rate decreases. The vagus moves down to the stomach, liver, pancreas, small and large intestines. The stomach starts to rumble and contract, the liver is primed for storing glucose into glycogen, and the pancreas is ready to secrete digestive juices. The abdominal blood vessels expand and shunt blood from the muscles to the gastrointestinal tract, ready to digest. The small intestine is readied for incoming food, and the large intestine starts with peristalsis to move food through the system. The sacral nerves send axons to synapse on ganglia by the kidney, bladder, and rectum. The kidney starts to filter the fluids and salts, the bladder is ready to void, and the rectum is ready for evacuation. For the parasympathetic system, the preganglionic nerves are long, going from the brain and lower spinal cord all the way to the target organs. There the nerves synapse on local ganglia on or near the target organ. The postganglionic fibers are very short, from the local ganglion to the organ. This is the opposite of the sympathetic system. The SNS and PSNS must work in a coordinated way to keep the body working as well as it does. An example that works to illustrate this is a car. It needs both a gas pedal and a brake pedal to function correctly. This ends the video on the parasympathetic nervous system.